Did you know that the liver performs over 500 vital functions but often communicates its distress in the most unexpected ways? This remarkable organ, tucked away under your rib cage, is a powerhouse of activity. It's not just a filter for toxins. It plays a pivotal role in metabolism, aids in digestion, and bolsters your immune system. Despite its critical functions, the liver rarely makes a fuss, quietly enduring until its troubles can no longer be ignored. Stay tuned as we uncover 8 strange signs that your liver might be struggling. Ever felt itchy without a rash? It might be more than just dry skin. When the liver struggles to function properly, one of the lesser-known yet significant symptoms is unusual itchiness. This isn't your typical itch that a simple scratch can relieve. It's persistent and often intensifies during the night. The liver, when healthy, processes toxins and waste products smoothly. However, if liver function is impaired, substances like bile salts can accumulate in the bloodstream. These salts then travel to different parts of the body, including the skin. The accumulation of bile salts under the skin can cause a persistent itch, particularly distressing on the palms of the hands and the soles of the feet. This type of itchiness can be misleading, as it often occurs without any visible rash or skin change, which makes it even more perplexing. Over-the-counter creams and lotions might offer temporary relief, but they fail to address the underlying issue. If creams and lotions don't do the trick, consider a liver check. If you're feeling unusually foggy or confused, your liver could be sending a distress signal. This isn't just about misplacing your keys or forgetting an appointment. We're delving into a more serious realm known as hepatic encephalopathy. It's a complex condition characterized by a decline in brain function arising from severe liver disease. Here's what happens. The liver, typically the detoxifier of our body, fails to filter out toxins due to damage or disease. These toxins, including ammonia, build up in the bloodstream and eventually reach the brain, disrupting normal function. This can manifest as confusion, poor concentration, or even changes in personality and behavior. Imagine your brain trying to function in a cloud of toxic fog. That's what hepatic encephalopathy can feel like. It's not simply an annoyance, it's an alarm bell that shouldn't be ignored. This cognitive fog is not just about being forgetful. It's a serious sign that requires immediate attention. Finding bruises on your body that you don't remember getting? Your liver might be hinting at something. When the liver is healthy, it's a bit of a backstage hero, quietly ensuring that your blood's ability to clot is up to scratch. This is crucial, because clotting helps stop bleeding when you're injured. The liver produces proteins such as fibrinogen and prothrombin, which are vital for this clotting process. However, when the liver is compromised, whether by disease, excessive alcohol consumption, or other health issues, its ability to produce these proteins diminishes. This reduction in clotting proteins means even minor bumps can result in bruising. Essentially, your skin becomes a canvas displaying the internal troubles brewing beneath. Each bruise, while seemingly minor, is actually a little red flag waved by your liver. Think of these marks not just as bruises, but as whispers from your liver, urging you to pay attention to its health. These unexplained bruises are a signal not to be ignored. Yellow isn't just the color of sunshine, it's also a warning light from your liver. When the whites of your eyes take on a yellowish hue, it's time to pay close attention. This phenomenon is known as jaundice, and it's not just about aesthetic changes. It signals that your liver is struggling. Jaundice develops when there's an accumulation of bilirubin, a yellow pigment formed from the breakdown of red blood cells. Normally, your liver processes bilirubin, converting it into bile, which is then excreted. However, if your liver is damaged or diseased, this process is disrupted. Bilirubin builds up in your bloodstream and begins to deposit in your skin and eyes, giving them a yellow tint. This yellowing isn't limited to the eyes. It can also affect your skin, turning it sallow. But the visibility in the eyes often makes it one of the first noticeable symptoms of liver distress. Remember, jaundice isn't a condition to be taken lightly. Yellow eyes should prompt you to yellow the lights and consult your doctor. Notice your urine turning a dark shade? It's not just about dehydration. While it's common to think that not drinking enough water is the main culprit for dark urine, there's more to the story when the color deepens persistently. Dark urine can be a telltale sign of excess bilirubin in your system. Bilirubin, a byproduct of the breakdown of red blood cells, is normally processed by the liver. When your liver is underperforming or damaged, it struggles to filter out bilirubin effectively. As a result, this substance can accumulate and find its way into your urine, giving it a darker hue. This symptom is particularly concerning because it suggests that the liver isn't just sluggish, it might be seriously impaired. Alongside dark urine, you might notice other worrying signs like yellowing of the skin or eyes, which are classic indicators of jaundice. Hydration is key, but if your urine remains dark, it's time to check on your liver. Swollen legs and abdomen may not just be about weight gain or water retention. In the context of liver health, these symptoms can be significant indicators of underlying issues. When the liver struggles to function properly due to conditions like cirrhosis or hepatitis, it can lead to a fascinating yet concerning phenomenon known as ascites and edema. Ascites occurs when fluid accumulates in the abdominal cavity, a direct result of the liver's inability to produce enough protein called albumin. Albumin helps maintain the pressure within our blood vessels, and without it, fluid seeps into surrounding tissues, causing swelling. Similarly, edema in the legs arises when pressure builds up in the veins and capillaries due to a damaged liver. This increased pressure forces fluid into the spaces between cells in the lower extremities, leading to noticeable swelling. These symptoms are not just uncomfortable, they signal significant distress within the liver, hinting at its compromised ability to regulate body fluids and blood pressure. If you notice swelling that does not resolve with rest or elevation, consider a liver health evaluation. Ever wondered why your breath might smell foul despite good oral hygiene? Well, it's not just about what you ate last night or how often you brush your teeth. Sometimes the issue runs deeper, quite literally, to your liver. This unusual symptom is known as fetor hepaticus, a rather fancy term for when your breath has a musty or sweet-smelling odor, which is a direct result of liver disease. But what exactly causes this peculiar scent? It's primarily due to a compound called dimethyl sulfide, a byproduct of liver dysfunction. When the liver struggles to break down and remove toxins from the body, these compounds can accumulate and be released through your breath. It's a stark reminder that every organ, no matter how silently it works, has a critical role to play in our overall health. So, next time you notice an unusual odor on your breath, consider it more than just a social faux pas. Bad breath can be embarrassing, but it might also be a call to action from your liver. Losing your appetite can be due to more than just stress or a bad mood. When the liver struggles, it impacts more than just digestion. It can significantly alter your eating habits. Liver disease often leads to a severe loss of appetite. This isn't just skipping a meal or two. It's a persistent disinterest in food that can last for days or even weeks. Imagine your favorite meals no longer appealing to you, every dish seeming just bland and uninviting. This change is not merely inconvenient. Without a regular intake of food, the body begins to lack the necessary nutrients it needs to function optimally. Over time, this can lead to weight loss and, more seriously, malnutrition. These conditions can exacerbate the weakening of the body's systems, creating a vicious cycle that further impairs liver function and overall health. If you notice that meals are becoming less appealing and this change is consistent, don't brush it off as a phase. If food starts to lose its appeal consistently, it's worth discussing with a healthcare provider. Recognizing these strange signs early can be crucial in managing liver health. Throughout this discussion, we've explored a range of subtle, yet alarming indicators that your liver might be under distress. From the persistent itch that won't subside to the confusion that clouds the mind, each sign is a critical piece of the puzzle. Remember how we talked about those unexplained bruises and the whites of your eyes turning a telling shade of yellow? Or the dark urine that signals trouble long before you feel pain? These are not symptoms to ignore. Swelling in the legs and abdomen, foul breath that doesn't improve with oral hygiene, and a sudden disinterest in food. These signs paint a picture of a liver crying out for attention. The liver, your silent sentinel, does not complain loudly until it's too late. Your liver is a lifeline. Don't wait for pain. Liver damage seldom hurts until it's serious. Schedule regular checkups and stay vigilant about your body's signals.